Okay, Assalamualaikum warahmatullahi wabarakatuh. Today we will continue Chapter 3, Introduction to Safety Part 2. Okay, the learning outcome of this topic will be students should be able to identify and explain what is hazardous chemical. Second, classify the hazardous chemical and explain about hazard pictogram. Third, identify and describe the type of laboratory hazard and its prevention. Okay, first of all, we will go to the laboratory hazard and risk. Okay, this is the classification of hazardous chemical. So for classification of hazardous chemical, there are 16 hazard classes under physical hazard, 13 hazard classes under health hazards, and 3 hazard classes under environmental hazards. Okay, if you can see the table below is environmental hazard. Okay, there are 3 classes and its category. So if you want to see the details, you may refer to Tata Mara Industry and also in the reference book Arrangement of Regulations. Okay, arrangement of regulations. Okay, next, physical hazard. Okay, physical hazard, there are 16 classes from explosives until corrosive to metals, and also the hazard category. Next is health hazard, 13 classes here. If you can see from the acute toxicity, oral until expiration hazard. Okay, for identification of hazardous chemical, at a minimum you should post the following sign in each laboratory. First, a listing of telephone numbers for CMU police and safety coordinator and supervisory personnel. Location sign for safety equipment such as safety showers, eye wash station, fire extinguishers, emergency cut-off switches, and first aid equipment. Third is sign designating the location of safety data sheet information. Fourth is sign designating the areas where food and beverage are not permitted. Fifth, warning sign where dangerous equipment is in use or where potentially dangerous operations are taking place. Okay, for identification of hazardous chemical, each new chemical container must be labelled with following: name of chemical, hazard warnings, name and address of supplier. And you must label each transfer chemical container with the following: name of chemical, hazard warnings. Okay. Classification of hazardous chemical is specified under columns classification. So under column labeling, the hazard statement code H code, signal word, and hazard pictogram for each chemical have been determined accordingly, and which the supplier is required to put on the labels for hazardous chemicals. For full list of H code and corresponding hazard statement, you may refer to Appendix 3.1 Industry Code of Practice on Chemicals, Classification and Hazard Communication. Okay, this is hazard pictograms. Okay, the first picture is cylinder gas. Okay, where the gases under pressure. And second is corrosion. Corrosion, which is the corrosive to metals. And skin corrosion or irritation. Also serious eye damage or eye irritation. Okay, number 3 is skull and crossbone. Okay, which is acute toxicity, oral, acute toxicity skin, acute toxicity inhalation. Okay, next is exclamation mark. Okay. Fifth is health hazard. For this is respiratory sensitization, germ cell mutagenicity, and carcinogenicity. Okay. And 6 is environment, which is hazardous to aquatic environment, hazardous to aquatic environment, acute hazard and chronic hazard. Okay, next is exploding bomb, for explosive, and next is flame over circle, and also flame over circle. Okay, the list of hazardous chemical classification. Okay, so this is the list of example for the chemical name. Acetaldehyde, diethanol, acetic acid, acetic anhydride, acetone, propane to 1, propanone, and more. Okay, so this is the list example and the hazard pictogram. You may refer at the labeling. And type of laboratory hazard. Okay. First is chemical hazard. Okay, chemical hazard is type of occupational hazard caused by exposure to chemicals. Exposure to chemical can cause acute or long-term detrimental health effect. So there are many types of hazardous chemical, including neurotoxins, dermatologic agent, and carcinogens. So chemical can enter the body through contaminated food, inhalation, and absorption through the skin. Okay, strong acid and alkalis are the most common corrosive chemicals to which clinical technologies are exposed. So this occur mainly through the splashing of reagent during their preparation. So for biological hazard are infectious agents such as bacteria, virus, fungi, or parasites, which may be transmitted via contact with infected patient or contaminated objects, body secretion, tissue, or fluids. Okay, in the laboratory, both hepatitis B and HIV can be transmitted by infected blood and body fluid when they are in contact with the inside of the mouth, the eye, or with broken skin. Okay, neither of these two diseases can be transmitted through the air. Okay, next is physical hazard. Physical hazard are a type of occupational hazard that involve environmental hazard that can cause harm with or without contact. Okay, they include cuts from broken glassware, fire from leaking gas cylinder, or electrical faults. So the danger of fire is always imminent as long as they are volatile, flammable solvents in the laboratory. So a static spark or a spark from the refrigerator's thermostat can cause an explosion. So next types of hazard, laboratory hazard, is electrical hazard. So electrical units which are positioned close to the liquid. So this should be fit with ground fault circuit interrupters to break the circuit should any current flow to ground. So electrical fires are another common laboratory hazard which can occur when incorrect or unsafe cords and plugs are used. So any electrical appliance used in the laboratory should be fit for purpose, up to date, and correspond to connected devices before they are implemented. Any electrical apparatus from adapters to cable not safety tested could compromise the safety of the lab and research team. Okay, prevention of laboratory hazard. For chemical hazard, corrosive chemical should be appropriately labeled. Care must be taken when pouring reagent to avoid splashing. Okay, chemical for which there is little or conflicting information about potential toxic effect should be treated as toxic. Wash hand with soap and water immediately after preparing the reagent for carcinogenic substance. Take care not to peel the powder or breathe in its dust while weighing or transferring the chemical. A nose guard should be worn. Okay, for biological hazard, all needlers should be properly disposed. Laboratory workers should cover all cuts properly and wear gloves to avoid contact with specimens. A spill of patient serum or urine on the floor or laboratory bench should be wiped out immediately with hypochlorite solution to inactivate virus and bacteria. Always put on your laboratory coat to prevent laboratory specimen from spilling on clothes. Okay, for physical hazard, place fire extinguisher at strategic location in the laboratory. Smoking should be prohibited in the laboratory. All connection of flammable gases to instruments should, such as the flame photometer, should be leak-proof. Always work in the fume chamber when working with flammable solvent. Okay, for broken glassware, any glassware, pipettes, flasks, and breakers and beakers with a broken tip should be discarded as they are source of dangers. Okay, next for the electrical hazard, do not use improper flexible extension cords as a substitute for permanent wiring. Okay, the cord insulation should be in good condition and continue into the plug ends. So never repair cracks, break, cuts or tears with tape. Either discard the extension cord or shorten it by installing a new plug end. Take care not to run extension cords through door or window where there can become pinched or cut, and always be aware of potential tripping hazard when using them. So use only grounded equipment and tools and never remove the grounding pin from the plug ends. Also, do not use extension cord in a series. Just get the right length of cord for the job. And the use of hanging pendant and electrical outlet are whispered in research lab facilities to help keep cord off of floors and out of the way. Check electrical pendant to proper strain relief and type of bolt used. The bolt should be totally closed and without any holes. If it contains knockouts or holes for mounting, it is not the right type for a hanging pendant. Protect all the light within 7 feet of floor to guard against accidental breakage. Slip plastic protective tube over fluorescent bulbs prior to mounting or install screens onto the fixtures. Okay, so that's all for the part 2. Okay, thank you.